Good evening and welcome to Taking the Initiative. I'm Reverend Bill Kunze, your host for these weekly conversations with leaders in the nonprofit world and the health world and public service who are making a difference in all our lives and in our communities. I encourage you to visit our website at www.takingtheinitiative.com. We've got there an archive of the the last 3 years of shows, so if there are any you're particularly interested in and want to follow up on, you can, and you can see them. We also have links where you can give us your ideas, your suggestions, your criticisms. We love to hear from you, and that's the way you can participate in the show. Now, for the last several years, we have been, from time to time, focusing on health issues and their impact on all of us. And another conversation like that this evening, a conversation about preventing and taking care of breast cancer with one of the most well-known experts in our country on this issue. So after a couple of community issue announcements, a conversation with Dr. Christine Horner. Welcome back. I am very pleased to welcome to Taking the Initiative Dr. Christine Horner. Dr. Horner is a board-certified surgeon who came into national prominence in the late 1990s, leading a successful campaign, really, an effort to get a law adopted that requires insurance companies to pay for breast reconstruction following mastectomy. She is the author of the award-winning book, Waking the Warrior Goddess, her program to protect against and fight breast cancer. She's been a guest on almost every national network news interview show throughout our nation, so welcome to Taking the Initiative.
Thank you. It's my pleasure to be with you.
Well, first, before the male half of our audience hits those remotes,
Yes.
Why is it important for men, for people, for me, to be hearing this conversation tonight?
Sure. So breast cancer actually can occur in men too. It's not very common. In fact, 99% of breast cancers are diagnosed in women, but 1% in men. But even more importantly, what we know is that breast cancer, prostate cancer, and colon cancer are very similar tumors. So what causes one to grow or protects against one does it for all three. So this information applies to men in particular too, because of the breast and prostate cancer and colon cancer.
So guys, stay tuned now. Besides, your wives and mothers and daughters are all involved in this as well. Why are you... Speaking of being involved, why are you so involved in this?
Well, several different reasons, but my passion really came from the fact that my own mother had breast cancer, and she had her first diagnosis way back when I was in college, and so I had a special interest, got involved with American Cancer Society, and did a lot of breast reconstructive surgery in my practice. And then in 1993, insurance companies stopped paying for breast reconstruction. They said it wasn't medically necessary, and then finally I got a letter from an insurance company that said it was on an organ with no function, which was why they weren't going to pay for it. And I went, uh-oh, you just talked to the wrong person. So I organized a national campaign to pass legislation to make it mandatory that insurance companies pay for breast reconstruction following mastectomy. Actually worked in the States and then worked on a federal bill and met with President Clinton and Hillary several times, and we were able to get that bill passed in 1998. So now it's a federal law that insurance companies must pay for breast reconstruction following mastectomies. But during that campaign, my own mother developed metastatic breast cancer, and she died about 9 months later, so that really, rocked my world. And then in my practice, I noticed that my patients were getting younger and younger and younger until finally I was doing breast reconstruction for breast cancer, women in their 20s. And I thought, something is so wrong with this. So I started going through the medical research to see if there was anything that research showed that women could do to lower their risk. And this is back in the 90s again too, before Dr. Oz, and before we really knew anything. And so I started looking, and I found thousands of studies that show exactly why we have a breast cancer epidemic and prostate cancer and colon cancer, all the things we're doing to contribute to these diseases. all the things that we traditionally don't do in this culture that are highly protective, and they were all natural. So food, supplements, lifestyle choices are the number one influencing factors. And in fact, it's thought that 95% of the cases of breast cancer could be prevented through diet and lifestyle changes alone.
Well, that's amazing to hear. I wonder if we back up a little bit. We talk. What is breast cancer, and are there different kinds and forms?
Correct. Yes, there's many different kinds, but mostly what we know is that there's generally damage that occurs to the DNA in the cells, and the cells start to grow and divide, and that's normal processes. That's how our body regenerates itself and heals itself. But if the process continues out of control, that's what cancer is. And we see it as a result of toxins, of stress, and again, a lot of things that are damaging our DNA where it's not able to repair itself, adequately.
That sounds pretty general about cancer in general.
Right. There's hormones that are involved with breast cancer, as well as prostate and colon cancer, which is why they're very similar. So hormonal causes, having excess amounts of estrogen of various different types, fuels the growth of breast cancer as well.
Are there different kinds of breast cancer?
There are. So there's the most common type is called interductal carcinoma, meaning that it starts in the milk ducts. There's also a type called lobular that starts further out in the lobule portion, and that's actually more associated with hormone replacement therapy. We saw a significant increase, associated with that. And then there's much rarer, types that occur too.
Today, what are the typical treatments for breast cancer?
Well, today the typical treatments haven't changed in the last 30 or 40 years. So from a Western standpoint, the only thing that we offer women is to cut the tumor out, to do radiation, and to do chemotherapy. And nothing's really changed, in that realm. And actually, the survival statistics, if you look at them very closely, we haven't made such a huge impact using those treatments alone. But doing a combination of doing what we call complementary and alternative medicine, which is ridiculous because it's talking about our food, various different supplements and lifestyle. When we combine those, we get a 3 times better outcome than if we just do Western medicine alone.
What are the trends today in terms of incidence of breast cancer, and what populations and so on?
Sure. Well, obviously it's more common in women, and the older a woman gets, the more likely she is to develop breast cancer. However, what's interesting is that we found that the one group of women where the rates are still increasing are in young women, which is what my message is about, today, about talking about what we can do in prevention of young women in their 20s and their 30s and their 40s, way before mammograms are even, remotely recommended. Now, the good news is that we were seeing an increase in all age groups, and in 2003, there was a study that came out called the Women's Health Initiative Study, which was this prospective study where we get the very best information following people into the future. And we found that hormone replacement therapy was a very significant contributor to breast cancer. That year, the prescribing practices of this medication changed drastically, where it's not prescribed that much anymore. And the following year, there was a 7% reduction in breast cancer. The year after that, an equal amount of reduction, a 12% in postmenopausal women, and it stayed pretty stable since then.
So pretty much, I would assume you recommend women not to get that.
Not to take hormone replacement therapy. There's many natural things that you can do to balance your hormones.
And you mentioned that what's going against the trend is very young women.
Yes.
Why?
Well, this is, kind of a controversial area, but there's a number of theories of why we're seeing it in women as young as 20 years old. And that has to do with one issue is that in the United States, the age at which girls are going through puberty has gotten younger and younger and younger, and now the average age is 10 years old. Around the world, it's 16 to 17 years old. And if a girl starts her period at age 10 versus age 16, her risk of breast cancer is 50% higher for the rest of her life. And that's because she's having more menstrual periods over her lifetime. with each menstrual period, there's a surge of a type of estrogen called estradiol, which is the strongest, most abundant form of estrogen and the one that's most linked to breast cancer. So having this early puberty, which we think comes from not eating organic foods, so some of our pesticides, herbicides, growth factors, that they put in meats and so forth, are things that will stimulate the early puberty and also stimulate the growth of cancers as well. The other issue is that when a girl goes through her puberty, her breast cells are actually immature at that point. So they're more sensitive to environmental toxins, radiation, bad growth factors in our foods and so forth. And technically speaking, they say breast cells don't mature until a woman or girl has a baby. However, there's certain foods that they found that will mature the breast cells and make them more resistant to the environmental toxins. But that's one of the big issues, is that this increased sensitivity that they have over a fairly long period of time if they're starting their periods early. So that's one of the main reasons why we think.
So is that particular to the United States and Europe, or is that kind of worldwide?
It's much more common in Western countries. However, in areas like Asia and also so like Japan, China, that area, and also India, we find that the incidence of breast cancer, prostate cancer, and so forth is very low. And when we go through the medical research and look at the factors that we know that are contributing, the factors that we know can help protect against it, it's very easy to see why it's so prevalent in our culture and not so prevalent in theirs, because their habits are so healthy.
You now have a display, but we want to talk about your plan to prevent and fight breast cancer after the break. But I'm also wondering, is sort of sedentary lifestyles, do these contribute? And so many health issues seem to be related to our lack of physical activity. Is that
Yes.
possible? Is that connected to breast cancer as well?
Absolutely it is. In fact, when I started going through the medical research to see, what was associated with it, it's really interesting, because most of the things are not specific for breast cancer. In fact, everything that I found that contributes to the cause of breast cancer contributes to every single chronic disease. And the things that help to protect against it likewise will help to protect against every chronic disease. So many women who read my book, they said, this is kind of my handbook, my guidebook for good health in general. So definitely exercise is part of it. They find that people who even do brisk walking on a daily basis can have as much as a 30% lower to 30 to 50% lower incidence of breast cancer. If you do rigorous exercise, like me, I'm a runner.
You are.
I am. There's an 80% reduction in breast cancer in people that do rigorous activities.
Well, that's certainly an encouragement to become
That's
a
right.
runner. If I were, even my
type.
old knees, right? Yeah. And are you still performing surgery? Are you still?
I am not. So what happened was, when I started learning all this information and I got introduced to a system of medicine called Ayurveda, which Deepak Chopra talks about, and it's from India, 5,000-year-old system of medicine, holistic system. Ayur means life, Veda means knowledge. So it literally means the knowledge of life, and it teaches us basically what it means to be a human being and what the rule book is. I didn't learn any of that in medical school or in my residency. And so these particular systems, tell us all these natural laws that we're governed by as human beings. So for instance, Ayurveda 5,000 years ago said you should go to bed by 10 o'clock and get up by 6 o'clock. And guess what?
I'm in trouble.
You are in trouble. Because guess what? Research shows if you go to bed by 10 o'clock and get up by 6 o'clock, those are the optimal hours for sleep. If you stay up after 10 o'clock, there's all sorts of hormonal imbalances that occur. And in fact, people who stay up to midnight on a regular basis have twice the incidence of heart disease, diabetes, obesity, and cancers. Simple, cheap thing you can do. Go to bed by 10.
After this little personal scolding from me, we need to take a break, and we'll be right back to talk with Dr. Horner about her plan to prevent and fight breast cancer and all these objects on the table. So stay tuned. Welcome back. With me to talk about lifestyle changes that can help and prevent breast cancer and other cancers is surgeon and author Dr. Christine Horner. When it comes to preventing breast cancer, you have developed a comprehensive plan, right? And presented in your book, Waking the Warrior Goddess, your plan to protect against and fight breast cancer. Third edition?
It is, yeah. So it first came out in 2005 and actually won the Best Health Book of the Year that year. And I just recently came out with a third edition because there's so much new information that's come out in the last few years.
Well, give us a preview first
Sure.
of the plan as a whole, and then we'll go through some of the specifics.
Sure. So as a whole, it's basically looking at every element of your diet and lifestyle, and everything does have an influence. So if you're doing the optimal things like going to bed by 10 o'clock and exercising and really reducing stress in your life, or doing a stress reduction technique such as meditation every day or Tai Chi, Qigong, yoga, those kinds of things, those things will lower your risk. And there's all sorts of things that we do in our culture that raise the risk. So it's really trying to avoid those things that we know that contribute, and then doing the things that we know that are very protective.
And as I understand, you have kind of outlined actually some big bullet points for each stage of life.
Yes.
That you say one simple change that will have dramatic effects.
Correct, yes.
And you start right with preteen girls.
That's right. With breast cancer awareness coming up, we've kind of focused all of our attention in the past on women that are 40 and over. However, if we're seeing an increase in breast cancer in women in their 20s and their 30s, we know that the cells have actually started growing in the teen years. So the important thing is to know that breast cancer prevention does not start at 40. It should be starting as children and in the preteen years. So one of the most important things that girls can do is to eat tofu.
Tofu. Like in this, organic tofu.
Organic tofu is super important because we spray the heck out of tofu in this country and genetically modify it. This one is actually from Japan. So it's organic, no GMOs. It's called Morinaga. I really like this brand because it's easy to get, it's got great shelf life, and you can get it from Costco or any of the major grocery stores. But what the research shows is that if girls eat tofu pre-teen, that it will delay the onset of puberty. So now
You mean eat tofu or substitute it for something else?
For meat. For red meat particularly. But if you just eat tofu, it will delay puberty. The other thing that it does is it will mature the breast cells. So you don't have to wait to have a baby. It will mature the breast cells, make them more resistant to the environmental toxins and other things that can increase the risk. And in fact, they find the girls that eat a lot of tofu preteen and early teenage, 50% reduction in breast cancer for the rest of their life.
Is it a hard sell to get them off a quick burger onto tofu?
It could be, but you know what? The interesting thing about tofu is that it doesn't have much of a flavor, so it will take on the flavor of any dish. It comes in many different kinds of consistencies, so you can chop it up in vegetables, and it'll take on the flavor of those vegetables and the herbs, and you can actually put it in blenders and create dips out of it. So there's an infinite number of ways that you can use it, and there's lots of recipe books or on the web where you can get the recipes. Yes.
Is it catching on with these girls?
Well, I hope it is. That's what I'm out here telling girls to do, so we'll see.
Okay. Teenagers.
Yes.
How about, so who are a little older?
Yes. So one of the most important things for teenagers is to really strengthen the immune system. That's kind of true for every age, but our immune system is what keeps us well. It has all the cells in it that go out and look for foreign invaders as far as bacteria, viruses, cancer cells, looks at them, finds those things, attacks them, sends other cells in, to help take care of it. So mushrooms are actually one of the best things that we know of to help stimulate the immune system. Now, realistically, are you going to eat mushrooms every single day? Probably not, right?
Probably not. These look
Probably
good, but
not.
probably not.
Yeah, so that's actually where a supplement can come into place. And so this particular supplement is my favorite mushroom formula, which is called AHCC, and it stands for Active Hexose Correlated Compound, which is why we call it AHCC. But AHCC is from Japan, and actually they prescribe it in the hospitals in Japan for cancer patients because it helps with the survival statistics so much. And AHCC, again, widely used, second most common complementary and alternative medicine technique used in Japan. It lowers the risk of many different kinds of cancers. The really exciting research that came out of MD Anderson recently showed that it will kill the HPV virus. So this virus that causes cervical cancer, and they're recommending that 10-year-old and 12-year-olds get that HPV vaccine. And so that vaccine, if you start doing some research on it, it's really scary. So they have more complications and side effects associated with this vaccine, twice as much as any other vaccine that's been created in history. There's been 171 deaths of girls. I mean, even within hours of getting this vaccine, and permanent disabilities and 30,000 adverse effects. And I'm like, wow, if I knew that, and it was a mother of a teenage girl, no way would I give them that particular vaccine. Plus, it's only good for 5 years.
So I like the way you said it, don't shoot up with the vaccine.
That's right.
But eat things like mushrooms
and take the AHCC, because it kills the HPV virus and prevents the infection from recurring. And the side benefit is not death. It is actually helping your immune system and lowering your risk of developing all sorts of different kinds of cancers. So that's a great thing to take. In the 20s, and what we know is that alcohol.
Yes. No alcohol in our glass.
That's right.
Right?
Because what we know is that in the 20s, people like to party, right, and drink a lot of alcohol. But there's actually one of the things that we know is so directly linked to the risk of breast cancer is alcohol. If you drink 1 glass a day, it increases the risk by 11%. 2 drinks by 22 to 40%, and 3 drinks by 33 to 70%. And the reason is alcohol actually increases the amount of estrogen production. Male alcoholics are actually the one subgroup of men that have a higher incidence of breast cancer, because men will produce, estrogens too. Now, alcohol is high, if you're doing it in your 20s, you already have the highest amount of hormones that you have during your life. So that decade, it's more damaging than in other decades. Now, some good news with it is that they found a B vitamin called folic acid or folate. If you take that when you're drinking, it actually will reverse many of the damaging effects of alcohol. But do not drink any more than 1 glass a day if you're a girl in your 20s.
So particularly in your 20s is when that's particularly dangerous.
Yes. Mm-hmm. Yeah.
Okay.
Yes.
And a B12 complex helps you out, right?
Folic acid actually is a different type of a B vitamin. So folate or folic acid is what you want to do as a supplement. Just on the days that you're drinking, it'll help to eliminate any of the side effects for 1 to 2 glasses a day. But beyond that, it's just too damaging. So you never want to go above that. Yes.
So a woman who's moved ahead in life, and in her 30s, you have some special, one lifestyle change for that person.
Sure. So we've done lots and lots of research on probiotics now, and this is actually very important to take as a supplementation. So the type of bacteria that we have in our colon has so much to say about our health. You have no idea how much of our health actually depends on our colon, from the immune system. Many of the immune cells are created there, hormones, the way our foods are digested, and so forth. And so the research on probiotics is showing that it affects our health in dozens and dozens of different ways. So this particular probiotic is Bifidobacterium longum, or BB536. And I like this one because it's a human bacteria. We actually have more bacteria cells by weight in our body than human cells, believe it or not. So our bugs are really important for us. Most of the probiotics are made from animal bacteria. This one is human, and it also is very stable, so you don't have to refrigerate it. The other ones you have to refrigerate. But tons of studies on it, clinical studies, that have been done, that it really supports the immune system and health in other ways.
And I see some yogurts are promoting that they have a probiotic
That's
quality
right.
to them.
Yes, so there's many different kinds of foods that are actually great probiotic foods, and these are fermented foods, so like miso soup or fermented vegetables. Tofu actually has, some great probiotics in it, and yogurt, and kefir, are good ones too.
Kefir. What's kefir?
So kefir is actually more delicious than yogurt, and you buy it in the refrigerated section, and it's a drink. So it's like a thicker drink that tastes somewhat like yogurt.
And then the next, but before we go to the next category, did you skip this lovely item here?
This lovely item, yeah. So that is turmeric, and turmeric is a cousin of ginger. It looks like a ginger root, but if you cut across it, it's this bright yellow-orange color that we find in curries. And this is considered the #1 anti-cancer spice. There's been 7,000 studies done on turmeric, including at MD Anderson, the big cancer hospital, and it inhibits many different kinds of cancers, and they found over 150 different ways that it works. So including it as much as you can in your diet, you can find it in the spice section in the powder form, or you can take it as a supplement, too, because again, are you going to cook with it every day? No.
No, but I like curries.
Right. So you can do, tofu, mushroom, curry, stir, fry, pure medicine.
Every day. What about women 40 and over? You have some special recommendations there.
Yeah, so over 40, we've been saying, hey, you should get your mammograms done. And there's been a number of studies that have come out in this past year, long-term studies with large numbers of women that are calling mammograms into question. So we're not seeing any difference statistically in the mortality rates in women who have mammograms versus women who just do physical examination. In addition to that, they found all sorts of problems with mammogram, from producing radiation that increases the risk of breast cancer, to missing 20 to 30% of tumors, so women think they're okay and they're not. In women who have dense breasts, which includes 40% of the population, it's not appropriate. So doing tests like ultrasound, thermography, physical examination are thought to replace mammograms.
Well, thank you for that. I know you have much more to say, but much of it is in the book, which I encourage you to get and read, Waking the Warrior Goddess, and I encourage you to tune in again next week, same time, same place. Good night.